An update on Piedmont Henry Hospital, and also um, some tips for reopening our businesses here in the county as well. So we're really looking forward to that. A couple things I want to mention. This webinar will be recorded, so it will be available on our resource page, which is together4henry.com. And that's with the number 4, together with number 4 henry.com. And all our webinars that we've done previously are on there as well. So it will be up in a couple days if you need to go back and take a look at it, or if you know anybody that didn't get a chance to join us. Also, when the presentation is over, we'll have an opportunity to take questions. There is a Q&A feature and also the chat, and I'll be monitoring those. So I will go through those questions when we get to the end. So looking forward to that. One thing I do want to mention, on Monday of next week, we'll have a virtual town hall that we'll be doing through a Zoom webinar as well. And that will feature Joseph Henning with the Chamber President, Sherry Matthews with the county, Josh Finn with the Henry County Development Authority, and Mary Elizabeth Davis is going to kind of give us an update on the school system and where they're at coming up. So that will be really good. That'll be Monday. We'll send out some more information about that. So with that, I'm going to turn it over to Lauren Smeeding, who is who is the Director of Piedmont Healthcare. So Lauren, I'll let you make other introductions and kick us off.
Awesome. Thank you so much, Gary, and everyone on the line for having us. It's been a crazy time, and we're excited, though, to be talking with people in the community and sort of sharing some of our lessons learned and our experiences. We're going to start off with Dr. Lilly Henson, who took over as CEO of Piedmont Henry Hospital, I think in early February. So only like 3 months ago, but feels like probably 3 years ago. She took over right at a good time to lead us through a crisis. We're really excited to have her in the Henry community. Stole her back from Washington State so that she could be here. She's a neurologist by training and an excellent leader. So she's going to talk a little bit about our experiences at Piedmont, and then we will move on to return to work. I'm going to share my screen, but while I'm doing so, Dr. Henson, do you want to take it away?
I think I have to unmute myself first. Can you all hear me?
Yes.
Yes, good. All right. Well, hi everyone. My name is Lilly Henson, and as Lauren mentioned, it's a heck of a time to start a new job and try to be a CEO of a hospital. Literally, I think we had our first patient at Piedmont Henry literally about a month after I started. So talk about, for all of us, you know, this pandemic is obviously something new, and we've all been learning to write the playbook as we've gone along. Piedmont's been on the front lines of taking care of COVID patients. We've learned a lot. We've done a lot of really amazing things that we're really proud of, and we just want to talk about some of the things that we've learned and share it with our community partners as well. One of the things that I want to mention is the amount of support we've gotten from Henry County has been amazing. Our community has just shown our staff a tremendous amount of love, and I can't thank all of you enough for what you've done. It really means a lot. You know, particularly early on, it just felt like dark days, and there was a lot of fear, a lot of angst on all of our parts. And knowing that our community was there supporting us and having our back really meant a lot. So Lauren, if you don't mind showing the next slide. So this is what all has happened at Piedmont Healthcare, and we can talk a little bit more about what's happened at Henry. So the first COVID patient showed up within the Piedmont system on March 10th. Both we and our sister facility at Fayette were the first hospitals to get our COVID patients. That was obviously quite a new experience for all of us, as we knew very little about the condition and what all we needed to do to manage that. Because the big concern was to ensure that we had the personal protective equipment that we needed to protect our staff so that they can take care of our patients. there was a lot of focus on ensuring that we had the appropriate PPE available. And we followed the CDC guidelines in terms of what the appropriate PPE was. So for example, patients who were in the ICU or patients who were generating aerosol, were in procedures that were generating aerosol generating procedures, the staff taking care of them had to be in different equipment than just someone who was COVID positive but who didn't fit that criteria. So trying to keep track of what the CDC's recommendations were and ensuring that we were doing what was recommended was quite a learning experience for all of us. You know, and as the guidelines changed on a daily basis, it obviously was up to us to try to keep track of that as well. Fortunately for us, here at the facility, Piedmont Healthcare set up an incident command center. So what they were able to do at the corporate level was to be able to weed through all of that information, what was considered best practice by the CDC, and make the recommendations not just for us here at Henry, but for all of our sister hospitals. So we didn't have to focus on trying to ensure that we were staying up to speed on the latest and greatest recommendations, but could focus on ensuring that our facility was ready to take care of the patients. So we did that. One of the concerns was to ensure that we had enough ICU beds available. So probably about 25 to 50% of COVID patients ultimately can end up in the ICU. So we had to make sure that we had enough beds available. In the past, we've had 24 ICU beds here at Piedmont Henry. We planned to go up to as high as 100 ICU beds as we anticipated the surge that you know, some of the other states had seen. Fortunately, we never got there. We did take over our intermediate care unit and converted, so had a total of 40 ICU beds up from our 24, and was prepared again to take the next unit over to generate more ICU beds. One of the nice things about being part of a large healthcare system, however, is that we were able to take advantage of the resources that were available. So Piedmont Atlanta Hospital, which had a tower that was scheduled to open up in August, went ahead and opened up early, and when we got to our capacity of what we could staff safely, we were able to transfer some of our patients up to Piedmont Atlanta so that we weren't straining the system here at Henry. This was true for all of our sister facilities as well. Similarly, you know, some of you may have read in the press about how some of our hospitals up in New York, for example, were running out of ventilators. Well, we were really lucky because we were able to share ventilators amongst the healthcare system, as well as getting some from GEMA, the Georgia Emergency Management Agency. And we got a huge amount of support from the state as well as our Henry County in terms of some of the supplies we needed. So we were able to focus here at Henry on making sure that we were prepared for the patients as they showed up. The other thing that happened was we, to make a decision to ensure that we had enough PPE for all of our staff, not knowing how bad the surge was going to be, we decided to temporarily discontinue all non-essential services. So that for us were what we call surgeries that were non-essential. So for example, a knee operation or a spine operation, unless you were had an emergent need, like you needed a cardiac catheterization, or you needed, you know, your appendix taken out, what we considered non-essential surgeries were temporarily discontinued. The same was true for procedures as well. That allowed us to make sure that we were able to focus all of our energies on taking care of the COVID patients as they came in. We peaked in early April. We got up to I'm trying to remember what our highest number of COVID patients were. on any given day, but we peaked in early April. We never, neither we nor our sister facilities within Piedmont did not see the peak that was seen, for example, again in New York, where the hospitals were overwhelmed. We were able to safely and comfortably manage what we had. Since that time, our numbers have come down. We had been up until a week ago in the single digits, so we got as low as 3 COVID patients last week. Our numbers have slowly crept back up to about 15 as of today. Part of that, I think, has to do with probably the reopening up of Georgia and the presence of the virus in the community. And that's probably going to be what our baseline is. But, you know, 10 patients or 15 patients is a very small percentage of what we're actually taking care of in the hospital. And quite frankly, the rest of the hospital is opened up for business. So back in middle of April, we decided to cautiously open back up the hospital to start doing elective procedures again so that patients can get the care that they need. While we're doing that, we're obviously still monitoring what's happening in the community and making sure that we are prepared if our numbers go up and peak again. And there's ongoing conversations on a daily basis between us and our sister hospitals, again, within Piedmont Healthcare, on how to manage that, on how to make sure that we build up our PPE supplies so that even if more patients show up, we have what we need to take care of the patients. One of the limitations early on had been the availability of testing to see whether we could identify patients being COVID positive. Early on, it would take anywhere from 4 to 8 days to get a test result back. That was when we were counting on the state, the Department of Public Health, to do the testing because that was the only place where testing could be done. Shortly thereafter, we were able to get the test kits within Piedmont and increase the number of kits that we have. So we've been able to get test results very quickly within 24 hours. And we've expanded our ability to test our patients. So initially, the only patients who were being tested were those who were getting admitted with COVID symptoms where we had to know whether or not they had COVID. Now we're able to test patients, for example, who are coming in for procedures to ensure that we are able to protect our staff and our general public as they come into the hospital to make sure that the patients who were COVID positive were being appropriately monitored so that our other patients and our staff could remain safe. The other thing we did was to ensure, again, that we had adequate PPE for our patients and for our staff was we escalated our visitation level. And so right now we're at what's called visitation level 4. And basically what we've done is we've restricted visitors to the hospital except for a number of special conditions. So a woman who is laboring or someone who is at end of life or someone who needs a family member to help provide special needs. There are a number of special criteria that we have to determine who can come into the hospital to help take care of these patients or to meet the needs of our patients. But we've basically limited the number of patients that, the number of visitors into the hospital to ensure that the hospital is as safe as it can be and that we have the PPE we need for our employees and our patients. We are easing up on that slightly, again, as we have more availability of PPE, as we've expanded the number of procedures that we're doing in the community. We obviously want to make sure that our patients are able to have their loved ones there to help take care of these patients. So that's been our journey. We are now, we think the peak is behind us, and we have shut down our command center for COVID, but now have a recovery command center where we're focusing on how do we ensure that safety is our first priority for our patients and for our staff. We're trying to open up services to the community because we realize that as the fear of COVID is out there in the community, patients who legitimately need to be in the hospital are afraid to come in. So we've seen our emergency room visits drop by 50%. Our admissions to the hospital are at about 75%. So our hospital is about 75% full from its baseline. As if you've ever been in our hospital, you know that we've had the busiest emergency room in the Piedmont system and are frequently full and holding in the emergency room. But since the COVID pandemic has started, we have had a reduction in our numbers as the public is afraid to come in. And one of the things you need to hear is that it's safe to be in the hospital. And quite frankly, if you're having a heart attack or you're having a stroke or you have abdominal pain that might be appendicitis or a gallbladder attack, you need to come back into the hospital, right? You need to get the care that's appropriate for you. And what we want to do is assure our community and our public that it's safe to be here, because that's our top priority. While we're doing that, we're also obviously preparing to make sure that if there's another surge, that we're absolutely prepared. And our corporate departments are helping us ensure that, to make sure that we have all the test kits we need, that we have all the PPE that we need, that we have all the ventilators that we need. And the other thing that we're doing is trying to recover. So there's this misconception out there that because the hospital was full previously with COVID patients, that that must have been a really wonderful thing financially for the hospital, but in fact it isn't. And as you've heard on the news, similar to other hospital systems across the United States, because we've had to hold on our what we consider non-essential services, which really is the bread and butter for most hospitals, we have seen a tremendous hit on our bottom line and have been working to reverse the financial difficulties that we've had, despite the dollars that have come in from the federal government, which are a drop in the bucket compared to the losses that we and other hospital systems have sustained. So with that, that's a quick overview of what's happened here at Henry and within Piedmont Healthcare on the hospital side. I think I will turn it over to Alex now to speak about how to recover.
Hey everyone, thanks Dr. Henson. I'm Alex Koutsos. I'm the Executive Director over primary care and retail services in the Henry market, and I also have the Athens and Columbus market as well, so a little bit of Georgia. Suffice to say, the last 2 months have been probably felt like 2 to 3 years and just 7-day work weeks as we ensure that the employees were safe and our patients were safe, and we were doing good business of keeping our quality measures up to pace. So a couple of things that we've really figured out in this process, not to say we're perfect, but we've gone through enough of this now that we feel like we've got some things in play that we thought were essential and that everyone should know about. First was making sure that you have the policies, procedures, and communications in place, and how do you cascade that? Policies in healthcare is huge, making sure that whether it's PPEs that Dr. Henson alluded to, whether it's how we're caring for a patient or how we're handling certain equipment or how we're handling the patient, making sure that it's streamlined. So whether you're seeing a doctor, your cardiologist, or whether you're seeing your primary care doctor, that those things are being put in place and that we're all following it. And one of the things that Dr. Henson alluded to was the command center. So we couldn't just go willy-nilly and start doing our own thing. We had to put a formal process in place, send it over to the command center, which had a team of experts to vet it out, ask questions, and then once it was blessed, we then went ahead and dispersed it throughout the organization for everyone to follow. And then if there were questions or clarifying questions that needed to be answered, they would go to the people that will put the process together to work through that. And so we found that to be very essential to the success to making sure everyone was safe. And same with the procedures. The other big hurdle that I'm sure many of you probably battle on a day-to-day basis, and Piedmont's no different, is communication. We have 23,000 employees, 11 hospitals throughout the state of Georgia, and hundreds of practices. So how do you cascade the information that was essential to all the employees and providers, administration, to make sure that we were doing the things necessary to keep everyone safe. So a couple of things that we did, and obviously we had some bumps in the road and we had to call some audibles as we went through this. Email was obviously a big one. Standard meetings based on certain work groups, communication that was specifically sent out to the command centers. And one of the things we probably didn't allude to is we had many command centers within each of the facilities and then each of the support departments. So there was one point of contact for the command center to make sure that they get that information to the many command centers, and then they would disperse it amongst their departments. So we probably were overkill at times on communication, but we felt like overkill is better than not having enough information, especially when we were looking and working through processes to ensure the safety of the patients and our staff. So, you know, not every business is 23,000 big, but I think everyone can relate to the fact that communication is huge, and however that may work through your companies, we felt that having a one-stop shop and a process to change things helped with the dissemination of communication for our system. Now, there's another type of communication we had to do as well, and it's to you as the patients, and how to make sure that we got that communication out to you. Obviously, there's different facets of doing it. You know, we have email, we have phone calls, we have social media. We have, for those patients that were on our MyChart, we've got MyChart. You can visit the website and see the updates there. So we were always making sure we were working with the marketing team and the ops team to make sure that we were disseminating the information out to the patients and their family members, what we were doing to stay safe and what was going on operationally, if you could go see your doctor or not, if you are, you know, what was required to do that. And we'll go into that in a little bit here. So I think for most people, the next real question is really the screening and testing, and what do we need to do moving forward? And so let's talk about screening just a little bit, because I feel like there's a lot of misinformation out there. And Dr. Henson, correct me if I'm wrong, and I apologize. Dr. Lane Close, our regional medical director, couldn't attend today. But we've got two types of testing, right? We have swab testing through your nose. We jokingly say this in medicine that it's almost like a brain biopsy, because you really have to get into your nasal cavity to swab and test. And that will tell you essentially if you're positive or not for COVID. And if you are, obviously there's protocols out there. I'm sure all of you are well familiar with the self-isolation for 14 days, fever-free for 72 hours. But just because you are positive doesn't mean you can't come positive again, right? So then we have the antibody piece, and there's a lot of different tests out there for antibodies, and some are rapid response testing and some aren't. Piedmont as an organization opted not to do the rapid testing where you get your results in 15 to 20 minutes, because the accuracy is not very good. And we went with the PCR testing, which if you've been exposed or have known positive, and after up to 2.5, 3 weeks after that known positive, or even after you thought you were exposed, if you were to do the PCR blood testing, it's got a 99% sensitivity rate. So it's extremely accurate to say that, hey, you have the antibodies. Just because you have the antibodies doesn't mean that you're not going to get it again either. So there's a lot of different information going out there that we want to make sure that people are understanding of it. We've had questions already asked, well, why don't we have the rapid test? Well, we chose not to because it was a quality issue and it wasn't as accurate as some of the others, as the one we chose, the PCR testing. So we do feel like there's a way as an employer that everyone on this call would probably be in the seat of, is if you're having employees that are suspected positive, or you've had an exposure, an employee that's exposed, we have different methods to help support it, whether it's through Piedmont, which we'd obviously love to help and support our local businesses, or through someone else. I just think it's key to understand the different types of testing and what they truly mean as we go through the testing piece. And then if there's any questions regarding that afterwards, we can get into more details regarding that. Well, Lee, I guess we're leaving questions at the end, so I'll keep going through. Just some of the signs and symptoms. I'm sure everyone's well versed now. I feel like it's been successfully communicated, but just to make sure, you know, cough, shortness of breath, difficulty breathing, also fever, chills, repeated shaking with chills, muscle pain, headache, loss of taste or smell. The problem is all those signs and symptoms I just kind of spit out to you are very common to other signs and symptoms. So it's not always 100% foolproof that just because you have the symptoms you have it, or just because you have the symptoms you don't have it. We do offer the swab testing, and there's other forms of businesses that do the swab testing as well, that our urgent cares will do the swab testing, the Piedmont Well Streets will do the swab testing. We do not do swab testing in our primary care practices at the time. It's a swab testing is considered an aerosolizing procedure. And when you do an aerosolizing procedure, it increases the risk of the virus shedding and spreading through the practice. So we only do the antigen testing, the PCR antigen testing with blood at our primary care practices. So just put that out there as it relates to the testing piece. The other key piece on the testing piece I want to make sure that we're all clear about is, I work for you today. I feel like I've had some symptoms and I may be positive. I go get my test done and it's negative, and I go back to work, I'm free, right? Well, that's not necessarily the case. You were negative for that day, but it doesn't mean you weren't exposed to someone tomorrow, and then you may have it again. So I would say the biggest thing that we need to be mindful of is, you know, we always talk about, hey, you're sick, you got to work through it. You know, you want to get your job done, you want to be a good employee. This is probably not the time to be the super employee and pushing through maybe some illness because of the contagion and how contagious this virus can be. This is a time we do encourage you to stay home and protect the rest of your employees that you work, your colleagues that you work with. And during this time, do your self-isolation and then get you back to work as soon as possible, because all we're going to do is perpetuate the issue by doing things like this. So those are some of the things as regards to the testing and the testing strategies. I think, Lauren, if you want to switch over to slide 5. You know, some of this is in detail, the testing. I feel like we should just leave that for some questions at the end, because I think I hit some of this as far as the immunity and so forth and what that means. So actually, Lauren, can we go through slide 6? And I apologize, I'm jumping faster than probably Lauren is accustomed to. The biggest thing that I would say when it comes to all this is using some common sense as we go through this, and some of the stuff we should have been doing all along. Personal space, be mindful of personal space, you know, washing your hands, keeping your hands off your face. You know, the one thing that scares me with the masks and everyone wearing masks is you can tell which ones are used to wearing masks and not when I'm out in public. The people are not used to wearing masks or having their face all over their mask, keeping adjusting all that. It kind of defeats some of the purpose of the mask, but it's okay. Not everyone's used to wearing it. But think about high touch surfaces, decluttering things, and then visual cues. We talk about Lean, Six Sigma, 5S type stuff in healthcare all the time. And we try to do the same thing in healthcare, is giving those visual cues to trigger the employees and or our patients to make sure everyone's safe. So to give you a little bit of an example of what we did in primary care, if you were to set up an appointment tomorrow or 2 days from now for a visit to a primary care provider, we'll actually call all the patients that are on the schedule for tomorrow and go through the symptoms checklist and make sure that they're not showing any of those symptoms that could potentially mean they're positive. If they are showing those symptoms, we will go ahead and either set up a televisit, because we want to make sure you're okay, and if you need to be treated, we can do it that way. Or if we think it can wait, we'll reschedule for another in-person visit after the kind of the quarantine cycle. If you pass that triage call the day before, then when you come to the office the next day, you're actually given instructions by that triage call to bring a mask and then call the office, press 1 when you get here and wait in your in the parking lot. So you get here, you call the office, you press 1, you go right to the front desk. They will triage you again, and when you're ready to come in, you'll get someone screening you with the temperature mask. And we're not having anyone in the waiting room right now. So you're going directly from your car straight to the exam room, and from there you'll see your physician for whatever treatment you have. For some of our practices that I have in-house labs in the practice, the phlebotomist will actually come to you in the exam room to do your blood work, and then they'll leave, and they'll be appropriately gowned with masks, and we're not doing aerosolizing procedures, so you don't need the shield or the full don-on gown. The other thing we took into consideration is we actually, walked through the practice as if we were the patient and thought about every step of the way that you would encounter and how to make sure, it's clean, it's safe, and so forth. So all the exam rooms have been decluttered of non-essential things. So it's easier to clean surfaces. We don't have wasteful items just in there in general. Same with the front office desk, the back office desks. And just in general, we've just really done a thorough decluttering of things to make sure that we can continually clean. Actually, how we've always done, but just with less stuff around. And then again, there's no ability to sit in our waiting room or make sure the waiting room's clean. We are also screening our employees, so they have to do temperature checks before their day starts and then after their day starts. And just like we encouraged many of you, if they're not feeling well or if they have potential symptoms, then we're asking them to stay home because we want to keep the patient safe and our other employees safe as we triage our employees for potential positives, and then they'll go through the same quarantine process, and then we'll also test them to make sure that they're showing negative before they come back to work. So it may be overkill to do 2 times testing of temperature, but it's something as an employer you may want to consider at least in the start of a shift to do temperature checks. And if you do have an employee that's positive or known positive, because of the expansion of telehealth, we're able to get your employee a telehealth visit, get a test ordered at the back end of their quarantine, so they can flip right back into getting into work quickly without any longer delay than the 14 days that you're already quarantined, especially if they've been asymptomatic. We can actually see them on their 13th or 14th day, get the order written for the employee and get them tested. So once they get the results back, which is around 2 to 3 days right now, and then you get them back to work for you after that. So that's essentially what we've been doing to make sure that we're making it safe again for both the patient and the employees. And those are the things that I would highly advise in your place of business is go through the day of a consumer and see what potential risks that they could potentially have of either getting too close to someone or just contact, and how to prevent or minimize the risks. You can't 100% prevent a virus, but minimize it to the best as possible. Lauren, next slide. We just wanted to give you guys a little bit of a visual of what kind of the percentages of passing the virus. Obviously, if both the carrier and the non-carrier are wearing a mask, it's the less risk of transmission. But we can just give you a little bit of a percentage of what that looks like if the person carrying it doesn't have a mask versus the person that doesn't have it, and so forth. So obviously, if everyone's wearing a mask, that's the safest way to minimize the risk of the virus. Next slide. So the biggest thing here is really more questions and answers, any questions that you have, and then what can we do to be of service to y'all? Dr. Henson alluded to this earlier. We're part of your community, and we want to make sure that we're supportive of the community and what we need to do. What can we do to help to keep your community functioning and taking care of our citizens of Henry County? So I don't know if everyone's on mute, if they have questions, or if they want to text in, or I don't know how that's going to work, but I'm going to throw it out there.
Yeah, we've got the Q&A and also the chat open for questions. So, yeah, if anybody has some questions, now would be the time to send those in. I tell you one I've got right off the bat, Alex, is if you don't have symptoms right now, I know when all this started, people were saying don't get tested unless you have symptoms. Should you go ahead and get tested, even if you haven't had symptoms, haven't shown any signs of anything? What kind of are the recommendations there?
So if you're asymptomatic and you're not showing any symptoms, obviously most places now will still test you. I'd say that's a personal preference, but if you're asymptomatic, you don't have any risk factors, and you're not showing any signs, I don't know if it's necessarily necessary. If you do test and you do test positive, there's no treatment for you that we're due. The biggest thing is the quarantine,
Right.
and making sure you're fever free for 72 hours. So I really think it would be a personal preference. Dr. Henson, I mean, would you chime in?
Yeah, so, and as Alex has pointed out previously, your test result based upon the PCR tells you whether or not you have the virus at this moment, right? So you could test negative and that might give you some reassurance, but the concern there is that it will give people a false sense of security, that it's safe to go out into the community without your mask on. And the concern is that you might then get infected because you get exposed to someone. So, and if you get tested and you're positive, to Alex's point, there's currently no treatment. And so if you're having symptoms, the way you would manage this is to stay at home, push fluids, take acetaminophen, and rest unless there are more symptoms that would lead you to needing to come to the hospital. So testing when you're asymptomatic, unfortunately, doesn't help as much for the average person as we would like, unfortunately. And that's kind of my my take on that.
Okay. All right. Let's see. We have one question. We see lots of COVID-19 fatigue, businesses reopening, more travel, et cetera. What should we expect in the fall?
Yeah, so there is a risk that we'll see a spike. We're anticipating that we'll see a spike. Hopefully we'll have, more updates on the vaccine per se. The thing that I would say, and then Dr. Henson, you correct me or add or chime in, as businesses open up, and we're obviously balancing the economy versus the spread of this virus, and this is going to sound very cliche, use common hand hygiene. Wash your hands, keep your hands off your face. If you're not feeling well, don't send your kid to school if they're not feeling well, or, when school's back open, or if you're not feeling well, don't go to work. And then just keep surfaces clean. It's so simple, and people probably think we're oversimplifying it, but it really is just that, doing those things.
Okay.
The other point is that, until we get a vaccine and can get the community immune, really what Alice is describing is what we need to do. The big fear had been, and fortunately it didn't happen here, is that because people have not been exposed to the virus, and as they come in with their symptoms, that the healthcare system gets overwhelmed, right? Particularly early on when we were surprised at the lack of PPE that was available out there because our supply chain was interrupted. Now, as we've had improvement of our supply chain, we've been able to start stocking up on PPE. I think we'll be much more prepared to deal with resurgence, but obviously it depends upon how many people in the community get infected at the same time and show up on our doorsteps. And so a low level like we're seeing right now is manageable and probably is going to be our new normal, quite frankly. It doesn't create any anxiety for us because we know we have plenty of beds, plenty of supplies and equipment to take care of these patients. But it's if we get hit with a tsunami like happened in New York, for example, and Italy, where we would not be able to care for our community.
Okay. Thank you. We have one from an adult daycare center. Do you suggest for an adult daycare center that employees and participants get tested before reopening?
Get tested, can you?
I think they mean just get one of the COVID-19 tests
I would
before.
imagine if they're positive or not would be my first thought,
Right,
Dr.
yeah.
Henson.
Yeah, so I think it's again, the same issue that we mentioned, right, is that if you're negative now, it doesn't mean that tomorrow you'll be negative. So we have to be concerned about that. Obviously, if you're positive, a facility like a long-term care facility will be able to potentially isolate and that individual and ensure that the people who are taking care of those patients are adequately protected. That's quite frankly what we're doing in the hospital. We have specified spaces where COVID patients are taken care of. It's a fixed number of staff who are taking care of those patients so that the exposure to everyone else is minimized. And I think that in long-term care facilities where the patient population is more obviously inclined to be pretty sick from getting COVID, that if you're able to identify those who are positive, and if the test kits are available to allow you to test those patients on a regular basis, that would allow you to be safer.
And correct me if I'm wrong, if this is adult daycare and they're doing activities, then I would say mask of both the staff and the elderly.
Absolutely.
I would do screening. I would do temperature screening on both parties. And then just make sure the hand hygiene and whatever activities you're doing to make sure that there's clean surfaces and so forth.
Okay, great. We have one from one of our Main Street programs here in the county. And as they begin to reopen and start having events, in addition to having a safety guide to reopen, is Piedmont in a position to serve as a vendor or conduct on-site testing? And
I'll defer to you, Alex.
So whether it's an employer or some type of event, so yeah, we will definitely do what we can to help. We would obviously want to be touch base ahead of time, especially if it's a large gathering or if it's something it's planned. Then yes, we can get our ambulatory teams out there to figure out a strategy to do something, whether it's mass testing. We're doing it so just to shed light. We've been doing it in the Athens community. There's a couple of big manufacturing companies there. We're doing it for UGA athletics. So you Bulldog fans, we're doing all the testing for the athletes and doing all that as well. So yes, we can do some stuff to help. We just obviously need some time to plan because it's a little bit of endeavor. So that I think the biggest thing is either reaching out to the leadership at Henry Hospital, Dr. Henson and team, or myself, and we can definitely get some processes going.
okay, great. I do have somebody asking about the visuals from the presentation. Lauren, if you don't mind sending those to me, I can put that up on our resource page. Absolutely. With the webinar. So we'll have those available for anybody if they want to use those. And the next one I have, what do you think about the idea that the virus can be sustained through HVAC systems? Do we need to be concerned with every business that is a brick and mortar?
Dr. Henson, you can correct me if I'm wrong, but what we're seeing thus far, and part of the fear and one of the things why we did, as a global society, we shut down everything is we didn't have much intel on this virus. So every day goes by, we're getting more and more intel. So one of the things that's coming about is the surfaces, the transmission from surface to surface is not as much of a risk as we originally thought. So as we've probably not heard as much with the HVAC system, it's still a surface. And so it's, from everything I've read, and Dr. Henson, correct me if I'm wrong, it's actually a very simple virus that washing your hands breaks apart and actually deactivates the virus. So I just, I can't say 100% sure that there's no risk, but I just don't see that as a high risk, knowing what we know now about the virus. And again, as we gain more and more intel with research, we'll have more specifics, but it's no different. I mean, we don't stress about the flu through HVAC systems and so forth. Right. So everything that we're seeing right now doesn't lend us to say that it's that contagious. Otherwise, if that was the case, a lot of us that are still going into meetings and still going in at the hospital, then all of us administrators would be all positive because we're in these facilities. So and we're not. So I you never can say 100%, but I'd be highly skeptical that it's a high risk.
Okay. Let's see. I've got another one. Dr. Fauci seems optimistic that we may have a vaccine by late fall, early 2021. How long will the distribution chain take to distribute vaccines nationally? And if someone tests positive, what should be the immediate actions of coworkers in the office?
Well, I think those are two separate issues, but it certainly appears based upon, the news reports that a vaccine will be available hopefully by the end of the year or early next year. My prediction would be that the ability to disseminate that would be pretty quick. I mean, those of us who were around, I think back when swine flu hit, remembered how quickly we were able to get that out there. So I think there's certainly a lot of work going on to ensure that when the vaccine becomes available, we'll be able to get it out to the community pretty quickly. Could you repeat the second question?
If someone tests positive, what should be the immediate actions of coworkers in the office?
Alex, or do you want?
Yeah, no, yeah, it's fine.
Yeah, okay.
So
go ahead. No, go ahead.
Sorry. No, you said no. So we've had this actually already happen up in the east, over in the east, and so for anyone that's a known positive, obviously send home immediately, get them quarantined. You do have to try to track where that employee has been, or who they've been around. I would go ahead and probably send them home, and then probably put in process a case of getting them tested. And what we did is we had a contractor call us. We set it up through our Piedmont Athens Urgent Care, and they gave us a list of names, and we basically worked it out to get them triaged. Did a visit with the doctor to make sure that there was nothing else going on. Got them tested, and then got the results within 2 to 3 days, so we could get those people back to work. As we stated earlier, it doesn't necessarily mean that they're not, but if they haven't met those symptoms and they do test negative, then there's a high likelihood that they probably are safe to go back to work and get them to work. For the ones that test positive, then obviously we'd send them home for quarantine for the 14 days, and then asymptomatic. So that's something that obviously you want to try to act fast to minimize the spread, so it doesn't cripple your business. And then that's where I feel like if we can help, we'll do everything in our power to help.
Okay, great. All right. Well, that's all the questions we have right now. I think y'all did a great job covering everything, and appreciate all the information. And we will get that PowerPoint presentation. We'll get those slides up as well. So if anybody wants to follow through with those or share them with anyone, they will be on our resource page together, the number 4henry.com. So with that, that's all I have. Do any of y'all have any parting words for us before we sign off?
So Gary, what I'd like for our community to know is that we're here to be your partner. And so if you have questions, concerns, please contact us. We'd be happy to get the information you need. If I don't know the answer, as I frequently don't, I'll turn around to my colleagues and get the answers for you. But our job here is to be the healthcare partner for Henry County. And so we are more than happy to provide any help that anyone has, for any questions that anyone has.
Okay, great. And if anybody contacts us at the chamber with any questions, of course, we'll forward them on to Piedmont and get you the answers for those as well.
Thank you.
All right.
Thanks.
I think that's all we have. Thank you all so much for joining us. And again, this will be recorded and be available as well.
Thank you.
All right. Thank y'all. Have a great day.
You too.